out of there.
Ankle brachial pressure index testing can help identify those who require further vascular assessment, predict the healability of lower leg or foot wounds, and determine the appropriate wound care interventions. Perform hand hygiene before entering the patient's room.
Hi there, Shrek. How are you? Good. I'm going to do your Doppler test on you now to see how your APBIs are, to see about compression. Okay. But I need to put the head of your bed down, and it has to stay down for about 15 minutes to equalize the pressure between your arms and your legs, all right?
Okay, sounds good.
Thank you.
Help or assist the person to lie in a supine, relaxed, comfortable position to facilitate the assessment. The person must remain in a supine position for at least 15 minutes prior to and during ankle brachial pressure index testing to minimize any hydrostatic pressure inaccuracies.
All right, I'm going to take the blood pressure in your arms and the blood pressure in your ankles and your feet, and I'm going to use this using an ultrasound machine, okay? A Doppler machine?
Yep.
So I'm going to be putting some gel on you.
Apply an appropriately sized blood pressure cuff on the person's right upper arm, approximately 1 to 2 centimeters above the antecubital fossa.
Just going to find your pulse.
Cuff width must equal 20% more than the upper arm diameter or 40% of the circumference around the upper arm and 2/3 of upper arm length. Ensure there are no large air bubbles in the applied ultrasound gel, as the Doppler requires a continuous conducting medium. Turn the Doppler on and hold the 8 MHz Doppler probe at 45 to 60 degree angle to the artery.
All right, so I'm just going to inflate the cuff now so we can get a reading, okay?
Inflate the blood pressure cuff quickly to approximately 70 to 90 millimeters of mercury, and then further inflate in 20 to 30 millimeter mercury increments until the pulse sound is completely lost. Do not inflate the cuff past 200 millimeter mercury, as this may dislodge any plaques that may be present in the blood vessel. Gradually deflate the cuff 2 millimeter mercury per second until the pulse sound returns, and record the pressure at which the pulse sound returns. If it is necessary to re-inflate the cuff due to loss of sound, be sure to completely deflate the cuff before re-inflating. If the cuff is repeatedly inflated or left inflated for long periods, the systolic pressure reading may be falsely low. If the cuff is deflated too rapidly, the true systolic pressure may be missed.
Is that okay? All right. Let me just get some, wipe you off there.
A 5 MHz probe may be required if you find it difficult to locate pulses in a person with severe edema, lymphedema, or painful or extensive ulcers. Clean reusable equipment and surfaces touched during the procedure with warm soapy water or detergent wipes, and dry thoroughly to prevent cross-infection, returning reusable equipment to the appropriate places. Reassess ankle brachial pressure indexes every 6 months for people with healable lower leg or foot ulcers, every 6 months for people undergoing compression therapy, if the person develops signs of peripheral arterial disease, or if the person develops lower leg or foot pain unrelated to infection or injury. This procedure is intended to be used by frontline registered healthcare providers to assist with their assessment and management of people presenting with a leg or foot ulcer and/or lower leg edema or signs of peripheral arterial disease. This procedure should not be conducted immediately post-superficial bypass graft without first consulting with the surgeon. If the person has significant lower leg or wound pain, on the arm of a person with a dialysis fistula or who has had a mastectomy, or by a healthcare provider who has not received training in ankle brachial pressure index testing.
Good. All right, we're all done here. I just need to do my calculations, and we'll see what your difference is in your blood pressure between your arms and your feet, okay?
Calculate the person's left and right leg ankle brachial pressure indexes and compare with any available previous results.